Hello, my name is Dr. Mark Levandovsky. I'm the medical director and founder of Preventive Medicine and Cancer Care here in Denver, Colorado. And today I'd like to talk to you about the main differences between concierge care and traditional primary care. The three main differences that we're going to be discussing right now are going to be time, insurance guidelines, and relationship. As far as the time component, it's probably the most crucial one. And it's the biggest difference that really pales the traditional practice in comparison to concierge one. For an initial intake in a typical primary care setting, a physician or a physician assistant would typically spend 8 to 11 minutes to see a new patient, do the entire intake, take a medical history, see what the relevant issues are, and do an exam. And frankly, that is just often an impossible task. It's a feat that even the best doctor would be hard-pressed to accomplish and really be able to make an impact. In, for instance, my practice, a concierge practice, my initial intake is 3 to 4 hours. And that affords me the ability to really see the person who's in front of me, not just a patient, the person who's in front of me, what moves them, what's important to them, how do we meaningfully make a change for their personal life? How do I marry my medical concern and expertise with their personal drives and desires? That's unparalleled. And as a result, what I'd say, the second difference is that relationship and rapport. If I'm hardly seeing you and it's really turn, the amount of personal investment and rapport and relationship I would have would really be quite superficial. Not so in a concierge practice. Certainly in my practice, the amount of personal investment and relationship is really, really fundamentally different. And lastly, insurance guidelines are not tying the hands and feet of concierge doctors, which is very much what the traditional docs in the traditional practice are beholden to. It's very much the case that in especially screening and prevention world and proactive medicine, insurance guidelines are good several years behind what would be considered cutting edge technology and testing. And in my practice, for instance, again, we're not beholden to those, and imaging and cutting edge biomarkers and blood work analysis is actually incorporated into the program. So time spent translating into a very different relationship, and insurance guidelines really set a traditional practice apart from that of concierge care. Now, to further emphasize what the difference is with my approach at preventive medicine and cancer care and a more traditional concierge practice is expertise. I am triple boarded in internal medicine, hematology, and medical oncology. So the comfort level of what I can deal with and deal with often on a daily basis is drastically different than that of even a concierge internal medicine doctor who's typically comfortable in a realm of internal medicine. As a result, the testing, the imaging, the biomarker analysis, the cardiovascular testing that we do here in the office is just really unparalleled. For instance, we're able to do quantitative EEG measurements to look at one's brain function and brain age, at one's vascular age versus their physiological age, at markers of inflammatory condition, of biomarkers that have to do with cancer risks. So not just trying to detect a condition when it actually is playing out, but seeing who is at risk biochemically, in addition to genetically, for cancer, for cardiovascular disease, for autoimmune and inflammatory conditions, which makes a tremendous impact on us. Because remember, 85% of what happens to us is really modifiable and potentially preventable. The shoe does not have to drop for you to backpedal. Ultimately, what I would invite you to consider is to look honestly and carefully at your medical goals and your challenges and pick a practice that bespeaks and addresses those. And if we could be of help in that journey, by all means, feel free to reach out to us. We're happy to help. Be well and be healthy.